My name is Mi-Young Kim, and I'm with Connect for Health Colorado. Today, we're here to provide an overview of the individual marketplace. This is the component of Connect for Health Colorado that will help individuals, couples, and families purchase health insurance and access new financial help to reduce costs. Thank you for joining us, and I would like to start with a general description of the marketplace. What is Connect for Health Colorado? Connect for Health Colorado is an open competitive marketplace for individuals and small employers to compare information regarding cost and quality of health plans, shop health plan features containing the same base benefits, determine eligibility for and access new federal financial assistance based on income, and to be able to call, chat, or sit down with trained representatives to receive assistance. And finally, to be able to enroll in a health plan. Connect for Health Colorado is not a replacement for the current market or for agents and brokers who work in Colorado. The marketplace is not engaged with negotiating rates between carriers and medical providers. We are not a part of Medicaid, nor do we offer Medicare or supplemental health plans. Connect for Health Colorado is not a new government healthcare system. We are not a state agency or regulatory body, and we do not receive funding from the Colorado General Fund. What is the individual marketplace? The individual marketplace is one of two shopping paths offered by Connect for Health Colorado. The other shopping path is for small employers, and there is a separate webinar that we will be conducting and providing on our website regarding the small employer part of Connect for Health Colorado. The individual marketplace is a new resource for Coloradans seeking health coverage. We will be providing individual and family health plans with coverage that begins as early as January 1st, 2014. The shopping process will be online with assistance by phone and in person. And Connect for Health Colorado's individual marketplace is the only place where Coloradans can access new federal financial assistance to lower premiums, copays, and deductibles based on your income. Here we would like to provide information about who can shop on the new marketplace. The Connect for Health Colorado marketplace is for Coloradans who currently buy insurance on their own, Coloradans who are uninsured, and Coloradans who are self-employed. Coloradans who don't have access to affordable coverage through their employer can shop through the marketplace, and the Coloradans would need to have legal immigration status to use the marketplace. We are also available to family members and dependents of employees who are offered employee-only coverage by their employer. And again, Connect for Health Colorado is not for those eligible for Medicare or seeking supplemental health insurance. There are many ways to shop on the new marketplace. Starting October 1st, the website is connectforhealthco.com. You can go to that website today to get general information as well as to get an estimate of that federal financial assistance through a tax calculator. When we open, you will be able to answer a few questions and browse health plan prices and features, a type of window shopping, so to speak. You will be able to answer a few questions and get an estimate of your eligibility for new financial assistance. You will also be able to shop for the commercial health plans without financial assistance and to fill out the application for the new financial assistance programs, as well as for Medicaid and CHP Plus, and then to find out what benefits you're eligible for. And you will be able to enroll in health coverage that takes effect, again, starting January 1st, 2014. What can you shop for? What kinds of products does Connect for Health Colorado provide? We have new health plans, which are also called qualified health plans, that all include a comprehensive set of medical services and benefits. The health plans that we will be offering will be provided by a wide range of health insurance companies. They include All Favors Insurance Company, Anthem Blue Cross Blue Shield, Cigna, Colorado Choice, Colorado Health Op, Denver Health, Humana, Kaiser Permanente, New Health Ventures, and Rocky Mountain Health Plans. These are all the companies that have requested permission from the Division of Insurance to provide health plans through our marketplace. And that review process is currently underway by the Division of Insurance, and the information will be finalized in early August. The health plans, there will be different types of health plans, and they will include PPO plans, HMO plans, HSA plans, and a new type of health plan with high deductibles, mainly for young adults. We call them the CYA plans. You may have heard of them as catastrophic plans. And again, the purpose of the CYA plans is to provide an affordable option that has high deductibles, but the purpose of them is to protect you against a high-cost emergency. The health plans that we offer will include dental coverage, and some of them that won't, and so you can buy separate dental plans. You will also be able to find out your eligibility for Medicaid and Child Health Plan Plus, and at the end of the shopping process through our website, our plan is to provide a link to our customers to vision plans. We are planning to provide a wide range of customer support for our customers when we open. Customers can get help online, over the phone, and in person. There will be an online chat function as well as decision support tools to help our customers through the process. There will be help over the phone by trained representatives who will be located at a customer service center in the state through a toll-free number. You will also be able to obtain impartial assistance in person by trained and certified health coverage guides who are located at over 50 community-based assistance sites across the state. And you will also be able to receive assistance in person and by phone by licensed and certified health insurance agents and brokers who are working with our marketplace and are located again across the state. We wanted to provide some additional information about some of the key changes that are occurring in healthcare, and with those changes starting in 2014. Again, starting in 2014, you cannot be denied health coverage based on a pre-existing condition or your health history. You will not be asked about your health history or medical needs when you apply for health insurance, other than being asked about pregnancy status, tobacco use, and disability status. Those three questions are related to determining your eligibility for certain programs. Starting in 2014, more Coloradans will be newly eligible for Medicaid because of a state law that was passed this year. With that state law, adults earning up to about $15,000 a year, couples earning up to about $21,000 a year, and families of four earning up to about $32,000 a year will be eligible for Medicaid, and the marketplace will help you access that program as well as CHP+. Other facts to know is that there will be set open enrollment periods for the commercial health plans that we will be providing, so that you would be signing up for a plan that would have coverage for the calendar year. The first open enrollment period will be between October 1st, 2013 and March 31st, 2014. And then in future years, the open enrollment periods are expected to be between October 15th and December 7th. And again, that's for signing up for plans for the following calendar year. Customers who sign up by the 15th of the month will have coverage beginning on the 1st of the next month. If you sign up after the 15th, you will wait until the following month for coverage. So for customers when we open, it will be important to know that if you want your coverage to start taking effect on January 1st, you'll need to be signed up by December 15th of 2013. There will be ways to sign up for coverage outside of open enrollment periods based on different life change events, such as a loss of job, marriage or divorce, a move into the state, birth of a child, or a change in income. You can sign up for Medicaid and CHP Plus at any time during the year. The health plans that are offered through the marketplace will provide at a minimum the following categories of services. This package is also known as essential health benefits. They will include ambulatory patient services, emergency care services, hospitalization, maternity and newborn care, mental health and substance abuse services, prescription drugs, rehab and habilitative services and devices, laboratory services, preventive and wellness care and chronic disease management, and pediatric services, including oral and vision care. So again, all of the health plans that are offered through our marketplace will include these areas of benefits, and health plans will also be able to offer more than what's in this package. The question of how much these health plans will cost, we do receive often, and we will have more details in August once the Division of Insurance completes its review process of the plans that were submitted in May by the health plans in the state. So currently, again, the Division of Insurance is working through its review process. And just to provide you with some background, the health plan prices are based on your age, the region of the state in which you live, how many people are in your family, and whether you use tobacco products. Prices will not be affected by your health needs or history, and based on the preliminary information from the carriers, and again, this is what is being reviewed by the Division of Insurance, we're seeing a range of rates, and we wanted to provide you with some examples. So rates for a 21-year-old living in Denver from the majority of carriers range from about $146 to $234 a month for bronze plans, and from $192 to $279 for silver plans. And this is before any cost reductions through that new financial assistance. Rates for a 40-year-old living in Denver from the majority of carriers will range from $186 to $299 per month for bronze plans, and from about $245 to $357 for silver plans. And again, we want to emphasize these are preliminary information, and again, that the final information will be known in August. We mentioned in the previous slide bronze and silver plans, and we wanted to explain what those were. So when you come to the marketplace and you're looking at health plan options, there will be different ways for you to organize your options. And in this top bullet, we talk about these coverage levels. You may hear them also as metal tiers. And what that means is it's a category that shows how much of the services on average are paid for by the carrier and how much are paid for by the customer. So this will give you a sense of what your potential costs will be after you pay the premium. So you'll have that monthly premium to pay, but also there would be deductibles and co-pays and co-insurance that you would incur at the time of service. And so for the bronze plans, they will include a breakdown in which the carrier will pay for about 60% of the costs, and the customer will pay about 40% of the costs. And with silver, that cost breakdown again would be about 70% paid by the carrier, 30% paid by the customer. That breakdown for gold plans is 80% paid for by the carrier, 20% paid for by the customer, and platinum plans would have the most of the cost covered by the carriers, and again at 90%, with the customer being responsible for about 10%. To be clear, coverage levels, these bronze, silver, gold, and platinum, labels do not, they don't reflect the quality of the medical services provided in the plan or the types of doctors that you will have access to. This is a measure of how the costs are paid for, whether it's by the carrier or by the customer. You will also be able to look at your health plan options by the medical provider and facility that you prefer, by the company, the carrier that you prefer, and the cost, the premium. This slide discusses the financial assistance that will be available to individuals and couples and families through the individual marketplace. And again, this is based on your income, so that if you are an individual earning between about $15,856 a year and $45,960 a year, you would be eligible for that financial assistance. And this is determined on a sliding scale. So what that means is that the less you make, the bigger the financial assistance will be, and that the more that you make, the smaller that financial assistance will be. The eligibility for a couple would be an income of between about $21,400 a year and $62,000 a year. For a family of four, the eligibility would be for an income of between about $32,499 a year and $94,200 a year. We estimate that nearly 500,000 Coloradans will be eligible for this new financial assistance. It is in the form of an advanced tax credit, and the customer would have the choice of using that tax credit at the time that he or she enrolls in the health plan. The tax credit is managed by the IRS, and again, going back to the way that your rates are determined, the tax credit adjusts based on your age and where you live. So that if you are an older Coloradan, your tax credit would be higher because your premiums would be higher. There is a second type of financial assistance, and you may hear this as cost-sharing reductions. We like to call them reduced copays and deductibles, or reduced out-of-pocket costs. And this, again, is based on your income, and it's for an individual earning between about that $15,856 a year and $28,725 a year. And for a family of four, the income is between about $32,499 a year and $58,875 a year. And how this works is that based on your income, if you are eligible, you could essentially opt up into a plan that has lower copays and deductibles. And what that means is that when you get medical care, you wouldn't have to pay as much in those fees that, such as copays and deductibles, when you receive those services. So it's possible based on your income that you could get both types of financial assistance. And here's just a general example, and again, we don't have the final rates, and so this example is based just on some, general estimates. So you have Bill, who's 40 years old, and he earns about $30,000 a year. He comes to the marketplace, and he applies for the assistance to pay for his health plan. He finds out that he qualifies for $166 per month in that premium reduction. He shops and looks for health plans, and he picks a plan that costs about $375 a month. He decides he'd like to use that tax credit up front, so that when he checks out and enrolls in the plan, he will be paying $209 per month for that plan. And again, this is based on estimates, and we'll have final prices in August. Here's a little bit more information about how that tax credit would work. So a customer would need to fill out the financial assistance application and would have to provide a range of information about your estimated future income, your tax household, your identity, and other details that are necessary to determine eligibility. You will learn how much financial assistance you'd be eligible for. you would choose a health plan and then decide how much of that tax credit to use right away, or how much of it you like to save and then claim on your taxes when you file your taxes the following year. And to know that the tax credit will be the same regardless of the health plan you choose, so that you could, there would be potentially an incentive to choose a less expensive plan. And that customers who have a change in income would need to report that income to us so that we could redetermine your eligibility for financial assistance. That second type of financial assistance, cost-sharing reductions, here's some more information about how that works. And again, so the customer would fill out that same financial assistance application, providing the information about income, tax, household identity, and other details. You determine what you would be eligible for. It is possible for you to receive both forms of financial assistance. And if you're eligible for the cost-sharing reductions, you could enroll in a health plan that would have that lower copay deductible, and that for eligible Native Americans, they could potentially enroll based on their income into a health plan that would have no out-of-pocket costs. And what that means is, no extra costs other than potentially paying that monthly premium for your health services, as long as you're seeing doctors that are in the network. This slide shows a little bit more detail about how that financial assistance application would work and who can apply for it. You'll see in these boxes a reference to SSAP, and that's an acronym for Single Streamlined Application. And so the application can be filed through the website, by telephone, by mail, and in person. The customer could file the application, an adult in the applicant's household, authorized representative, or someone acting responsibly for an applicant. The application is used to determine an enrollment in the qualified health plans, your advanced premium tax credit, the cost-sharing reductions, and eligibility for Medicaid and CHP+. This slide shows us a little bit more of a flow chart around the types of information that would be asked in the financial assistance application. And the questions would be specific to each person in the household for which you are seeking coverage. We often get the question around what kind of information do I need to provide for that financial assistance application? And so that income is what they call an modified adjusted gross income, which is similar to the adjusted gross income that's reported on your 1040 tax form, and you'd add in some additional information, but that income calculation does not include assets such as property. We will ask for different pieces of information to verify your identity, such as social security numbers for each person who would be covered in the health plan. We'll ask you if you have coverage through an employer, Medicare, Medicaid, or some other policies. We will ask for information about your tax household, whether or not you live in the state, and your immigration status. And there will be some other questions specific to public programs and specialized populations such as Native Americans. These are all the types of information that are required, again, through the federal government, because this is a financial assistance that is provided by the federal government. We'd like to emphasize that the health insurance marketplace will comply with state and federal laws to protect your information. It is important for customers to understand that we take this responsibility very seriously. We won't use or share your financial information after determination of eligibility for financial assistance is made. We won't ask you for medical information, except for whether you use tobacco, whether you are pregnant, or have a disability. There will be strict security to protect access to files, And the website and backup systems will have strong protections against outside attacks. And again, the integrity and the security of the system and your information will be protected. And just as a general overview again around the benefits of Connect for Health Colorado, the marketplace will make comparing and purchasing commercial health insurance plans more convenient and competitive. We'll provide a broader array of choices in one place. We'll help you make an informed decision by creating transparency about your options, and we'll be the only place to check eligibility for new tax credits and to apply them right away to reduce your costs. We'll also offer you a statewide network of trained professionals to help you access the new financial help and to find the health plan that's right for you and your family. And we are a new service. We are a nonprofit and a new service with a mission to help Coloradans. There is a webinar coming up this Monday, July 22nd at 4 p.m. regarding an overview of the small business marketplace. And we invite you to sign up for that on our website. Here's information regarding how you could get in touch with us. Again, our website is connectforhealthco.com. You can submit questions by email to info@connectforhealthco.com. We also have a toll-free number where we have trained representatives available to answer general questions, and that number is 1-855-PLANS-FOR-YOU. And again, that's 1-855-PLANS-FOR-YOU, 855-752-6749. We have numerous social media channels, and we invite you to follow us on Facebook, Twitter, to view our videos on YouTube, and to follow us on LinkedIn. Thank you very much, and we look forward to speaking with you again.